If you're going on Medicare at 65, the last thing you want to do is make a mistake. Mistakes can cost you financially, you could go without coverage, and sometimes even penalized for life. So this is your Medicare guide to follow so that you'll have confidence with your Medicare choices. So in this guide, I'm actually going to address 3 different questions. The first question is, do I need to take Medicare? Some of you, the answer is yes, some of you, no. And let me explain. First off, if you right now are covered by some kind of retiree insurance plan, it could be you or your spouses, you have to go on Medicare at 65. Now, if you keep that retiree plan, sometimes that's good, sometimes it's not, but that retiree plan, once you're 65, only pays second to Medicare, so that's why you have to start Medicare at 65. The same thing is true if you are covered by you or your spouse's COBRA plan. Again, you have to start at 65 because once you're 65, that COBRA plan will no longer pay first, it only pays second to Medicare, and so you're going to have to enroll into Medicare. If you're on an Affordable Care Act plan, you went through the healthcare exchange to get an individual plan. Now, technically, you can keep an ACA plan once you're 65, but all the subsidies, the cost sharing, and all the benefits of that financially go away. So there's no reason to keep an ACA plan that I've ever seen once you're 65. You'll be paying full price for the plan, full deductible, full premium. All right, then if you are retired from the military, you're on what is called TRICARE insurance. Now, again, this is different from VA, but TRICARE means you served our country 25, 30 years, you retired, now you have TRICARE. Once you're Medicare eligible at 65, what happens, TRICARE insurance will still be there for you, but again, it only pays second to Medicare. It will no longer pay first, and so you got to enroll in Medicare to make that happen. Then lastly, if you're still employed and there's 19 employees at your company, you have a group plan, but there's 19 employees or less, again, you have to go on Medicare at 65, and the reason for that is because that group plan now only pays second to Medicare. So if you don't enroll into Medicare and there's 19 or less employees and you have a large claim, then that insurance company has every right to say, no, you should have gone on Medicare. Sorry, you didn't, but we're still only going to pay second. And that's why 19 or less, you have to go ahead and enroll into Medicare. All right, so these you have to. Well, who doesn't have to? Well, anybody that is working, them or their spouse, covered by a group plan at work, and that employer has 20 people or more at the company. That's the cutoff, 20 or more. And so in this scenario, you don't have to do anything with Medicare. You don't have to take A and you don't have to take B. Now, you'll hear in the public square people will say, well, you have to enroll into Medicare A and set up A only, and if you don't do that, you'll be penalized. It's not true. Okay, 99% of all people will get Medicare A at premium free. And so there will never be a penalty if it's going to be free for you. The people who have penalties on Part A are the ones that have to buy it. It's only 1% of the population. And so if you have 40 quarters or more, your spouse does, it's zero, and it'll always be zero for you. No penalties whatsoever. And the reason I mention this is because if you're at a group plan, 20 or more, and you have an HSA, and you take A only, you can put no new money in the HSA, nor can your employer. You're ineligible to contribute to an HSA once you have any form of Medicare, A or B or both. Okay, we just can't. And so you just shot yourself in the foot if you want to keep that HSA. Now, all the money you have there is your money, but no new money can go in if we have any form of Medicare. All right? And so if you don't have an HSA, it's fine to enroll into A only, no problem. But keep in mind, A is going to pay in the second position. Your group plan pays first, Medicare A pays second, and it doesn't pay co-pays, it doesn't pay deductibles, it only pays co-insurance on the A only side. So if you enroll, it's fine. I just wouldn't do it if you have an HSA. All right, now, some of you may be considering taking A and B if you're even in a large group. And sometimes that makes sense. I'll show you here in a few minutes. But I certainly, if I like my group plan and I don't have an HSA, I would do A only. I would not do B, and here's why. Because number one, you're going to have to pay for Part B, okay? And secondly, what's going to happen is they're in a second payer position. So you not only paid for your premium at your company plan, but now you're having to pay Medicare, that $164.90. So I would not take B if I have an employer plan, 20 or more at the company, and I like my plan, the cost and the coverage, all that. I would just simply have A only, unless, of course, I have an HSA. All right, so that's question number one. Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video. Now let's go to question number 2. Now we're talking about starting Medicare 65. So if you are presently on Social Security, in other words, you've already applied for those benefits, you took those benefits early, you will be automatically enrolled into Medicare. Okay, now today, let me just give you the date. Today's date is 2/27/2023. Okay, so what's going to happen is this. Let's say your birthday is down here in June, and this is when you're going to start your Medicare, June 2023. So we back up the clock here. This is 5/4/3. What happened this month? They automatically enrolled you into Medicare, and your Medicare card showed up just a little above 3 months before your birth month. All right? So that means if your birthday turning 65 in July, and you're already receiving Social Security, you're going to get your card mailed to you towards the mid to the end of March. If your birthday's in August, you're going to get it in April. So they always mail the card to you, automatically enrolled. You don't have to do anything. It's simply going to be mailed to you. They know you're receiving retirement benefits. They assume you don't have a group plan available. So that's why they automatically enroll you into Medicare A and B. Now keep in mind, that A and B card shows up, and again, as you saw earlier, if you have a group plan of 20 or more, you don't have to keep your Medicare B. In other words, if you like the company plan, then what you can do is you can send your card back in and actually disenroll from Medicare B if the group is 20 or more, and you have A only, and then you can pick up your B at a later date. That is actually called a special enrollment period. There's a lot of people that are on Social Security and also have a group plan. They don't know what to do with their Medicare card. Well, you don't have to keep Medicare B if that group is 20 or more, and that's a better option than your Medicare. Again, send the card back in, and they'll send you back a new card, and you'll have A only until you lose the group plan. All right? And so there's some of you that will be automatically enrolled into Medicare. Now, the rest of you, if you're not on Social Security, you are going to have to self-enroll. Okay? So if I'm going to self-enroll at 65, what happens is I have 7 months to enroll into Medicare. So let's go back to my example. Let's say you turn 65 during the month of June. We have 3 months before, and we have the month of, and we have 3 months after. So in this example, it'd be 7, 8, and 9. And so I have 7 months to enroll into Medicare if I'm going to self-enroll. You have to set up what is called a myssa.gov account. Takes about 10 minutes to do it, and then you can actually do an A and B application online as long as you have that SSA.gov account. This will take you maybe a total of 20 minutes. Now, if you decide to work with us, we'll do all this for you. Happy to do that. But if you do it on your own, that's the process. And so we have 7 months to self-enroll if I have to start at 65. If you try to do anything beyond that, you're going to have problems. All right, and so 3 months before, 3 months after. So if I enroll 3 months before, I set my SSA.gov account and enroll in A and B, my coverage begins on my birth month, right? If I enroll during my birth month, they start me in July. Enroll in July, they start me in August. Enroll in August, they start me in September. And if I enroll in September, the very last month I can enroll, then they're going to start me down here in October. So what are they doing? They're delaying my coverage 1 month. So how do I enroll? Well, we have to have an SSA.gov account, and we have to pick the right enrollment period to enroll in A and B. And of course, a lot of this can be done online, or you work with someone that'll assist you through this whole process. Now, keep in mind, if you have a group plan at 65, you don't have to do, remember, anything with Medicare. But if you take A only, and then if you want to pick up B at a later date, let's say you retire at 67 or 72, then you will come into Medicare using what's called a special enrollment period. All right, now, we still want that SSA.gov account, but we have 2 things added to the process. We have what's called an L564. This is a document verifying that we have had coverage at work all the way back to our 65th birth month. Okay, and so the employer fills that out, verifying that, and then we fill out what's called a 40B form, and then we tell Medicare when we want to start our Medicare. Again, this is for those of you who are going to stay on a group plan. If you or your spouses, you can come into Medicare, no penalties, no problem whatsoever, using the special enrollment period. We just have to prove we've had coverage back to 65, that was credible, and then we pick our month. We do all this process about 60 to 90 days before we lose that group plan. All right, so that's that question. How do I enroll into Medicare?
Hey, my name's Josh Musick, and if you've been enjoying my dad Marvin Musick's content, you really need to go to our website, MedicareSchool.com. When you go there, you'll be given the opportunity to download a free 1-hour Medicare Essentials workshop, and it's going to take you all the way from Medicare A to Z. By the time you're done watching that workshop, you're going to know how to enroll in Medicare, when to enroll in Medicare. You're going to know the differences between Advantage plans, supplemental plans. You're going to know how to get drug coverage. You're going to know everything you need to know to get the best coverage possible. So go ahead, go to MedicareSchool.com and watch the Medicare Essentials workshop.
All right, the third and final question is this: what are my Medicare insurance options? So once we made the decision to go on Medicare and we've set up our A and B enrollment, you will find that you really only have two insurance options. You can either stay in A and B, and you get a supplemental plan, which is also called a Medigap policy. So those are synonymous. That's one option. The other option you have is you can enroll in A and B, and you get a replacement plan, which is called a C plan or an Advantage plan. All right? Those are your only two options. Now, the thing that these two systems have in common is this: I've got to be enrolled in A and B to have a supplemental plan. I have to be enrolled in A and B to have an Advantage plan. And so the issue is this: B always has a premium. This year, it's $164.90 a month. All right? If I'm over here, same thing applies. I'm enrolled, I got to pay my Part B premium. Now, if you're on Social Security, that comes out of your check. If you're not, they'll set up a monthly bank draft, or they'll bill you quarterly for that. And then once you go on Social Security, again, they'll start taking that out of your check. So that's the one thing these two systems have in common. We're enrolled in A and B. Now, the way they differ is here, if I stay in original Medicare A and B, that means that A and B is going to be the first payer. Okay? Now, other than preventive services, A and B will not cover anything 100%. So in this A and B system, what we have what's called gaps in your coverage. Things that Medicare's not, they pay first, but they don't pay 100%. And so what we have on the A side of Medicare, which is inpatient, we have 3 gaps. Those include a deductible and copays. On the B side of Medicare, which is everything outpatient, as well as all doctors, whether we see them in their office or they treat us in the hospital, doctors are always paid through the B side. We also have 3 gaps. All right? And so what happens is, if I decide to stay in this system, most people don't want the liability of those gaps, and so they will buy what? A Medigap policy to fill in those gaps. And again, there's a lot of other details I could share, but what I want you to see with this one is your insurance option is to stay in A and B, get a Medigap policy. What happens is most people there are getting a Medigap F, a G, or an N. Let me just quickly tell you the difference. F is truly a full coverage plan. Covers all the gaps in Medicare, which means if someone has an F plan, they should never get a bill. Medicare pays first, F fills in all the gaps. Now, the issue with the F plan is a lot of people can't buy it because F plans are being phased out. Anyone born before January 1st, 1955, which were eligible for Medicare before January 1, 2020, you can still get an F plan, okay? You're still eligible for that. That group was all grandfathered in. Millions of people on F plans. They're not going to lose them, but anyone born after January 1st, 1955, which means eligible for Medicare after January 1, 2020, then you would have to get a G plan or an N plan. And there's a couple others, but this is what most people are getting. Now, the difference is the G plan, we're going to have a little bit of a lower premium than the F, but the G plan fills in 5 of the 6 gaps. Remember, F covered 6, G covers 5 of the 6 gaps. So the one gap that the G plan doesn't cover that the F does is the annual Part B deductible. This year, that's $226. That's it. You meet it once a year, you're done. And then every January, we have a new B deductible. You'd meet that again. So again, this year is $226. Now, the one below that is called the N plan. It fills in 4 of the 6 gaps. The gaps it does not cover is the B deductible, just like the G didn't, and it also does not cover excess charges. So if you go to a doctor that adds to the Medicare bill and you have an N plan, you're going to pay that out of your pocket. Plus, every time I go to the doctor, I can have a $20 copay. I go to the emergency room, I can have a $50 copay. So we have a little bit lower premium, but we're also going to have some more liability as well out of pocket on the N plan versus the G plan. And there is no right or wrong. You just have to decide which one you're going to be most comfortable with. But the whole point is this. This is one option that you have for Medicare. Stay in A and B, they pay first. The Medigap policy fills in the gaps based upon your choice. Now, the other way we can do it is do an Advantage plan. And so what we have here, these are accurately, the best word for these are called replacement plans. So what's happened, you've actually reached out to a private health insurance company to replace original Medicare A and B for you. And so now we have a private health insurance company. And the difference is this. When you have a private health insurance company replacing Medicare, you're going to be, number one, on an HMO plan or a PPO plan. Over here, you didn't have any network at all. You could go anywhere that takes Medicare. Over here, you got to make sure, unless it's emergency or urgent care, that plan takes, that doctor, that provider actually is in your network, all right? It's just the cheapest way to go. And so if you go someone that's in network. So we have HMOs and PPOs. Another issue that we have here is just beyond the networks is now what we're doing, we're going to have co-pays and co-insurance out of pocket, okay? Because on these Advantage plans, almost all of them don't charge you any money to be on the Advantage plan. So instead of paying a premium, as we would have over here, now over here all we're doing is pay as we go. All right, so go to the hospital, maybe $350 a day, $350 a day. Have an MRI, may cost you $250. See a specialist, may cost you $50. But you pay as you go until we hit what's called the annual max out of pocket. All right, and this is going to be anywhere from about $3,000 to about $7,000. Over here, the max out of pocket was my premium, and like on the G, a small B deductible. Over here, it's going to be somewhere between $3,000 to $7,000 because I pay as I go. No premium, but again, I'm still going to be out of pocket. So either way, we're going to pay. So that's your option. Now, a couple things I just want to mention in closing is if I choose either one of these, here's another big difference. If I choose this system, I have no pre-authorizations, which means the insurance company has no say-so. The doctor says, I need a knee replacement, hip replacement, MRI, and Medicare says, we'll cover that. End of story, goes on the schedule, and it's all done. No pre-authorizations here. In this system, there are pre-authorizations, and that just simply means that insurance company does have the final say-so. So doctor says you need a knee replacement, hip replacement, skilled nursing stay, an MRI. Well, the insurance company has to agree with that decision and approve of that before you get it. And sometimes they they will approve it. But sometimes they delay the approval or actually deny that coverage. And that's just the way this system works. Why? Now you have a private health insurance company that has the final say-so. All right. And then lastly, if you do decide to get an Advantage plan, you got to keep this in mind. If you stay on that Advantage plan 2, 3, 4, 5 years down the road, and you ever want to switch from here over to here, in 46 of the 50 states, to get off Advantage and go to the supplemental plan, you have to go through underwriting, which means medical questions. We got to check your prescriptions. And so that underwriting process, if you're unhealthy, you may not be able to switch over to this system. Now, when you first go on Medicare, all the insurance companies have to take you here. No underwriting required whatsoever. They have to take all your pre-existing conditions. But that period of time is limited. 6 months before you go on Medicare and 6 months after you started your Medicare B. There's no underwriting required here whatsoever. But after that, if you want to get a supplemental plan, now you may have to go through underwriting. All right? And so you just have to be aware of that. So those are your two insurance options. What do they have in common? They only have this in common. You got to be enrolled in A and B. And then beyond that, there's drastic differences between these two systems. You have to decide what you think is best for you.